Hi, so this is Parker Canario doing her assignment for Module 4 at Aspen University's nursing school. I'm going to be going over the scenario and then the research question as well that was asked. I'm not going to state the scenario because, of course, our teacher should know the scenario, so I'm not going to need to cover that. The scenario basically is a patient showing up to the ER with a bit of delirium, confusion, combativeness, and she reeks of urine, giving off a stale odor, and she has a couple scrapes on her body. So our goal is to try to figure out why this patient is coming in, what is going on, and then what assessments are needed to monitor this patient. So I'm going to cover question 1, and it says, what do you expect she's suffering from? In this case, I expect she's suffering from substance abuse. It seems as if when she requested for a bottle, I'm assuming a bottle as in alcohol, because of her age, I think it said 53, and because of the odor that she's giving off, I would assume she has been drinking, maybe a little bit too much, and has become delirious. Has fallen, hurt herself. Of course, we want to assess her scrapes and bruises on her body, make sure we document all of that. But she is going through withdrawal, which can equal the combativeness and the delirium. Because of her blood levels could be toxic, which therefore she won't remember very much, especially if she's been drinking too much. And at this point right now, because she had just come in, we're not too sure of what those levels are, but of course that is something that we would want to do, and that is answered later in another question. Another question is short-term side effects. Some of the side effects that she could be struggling from are shallow breathing, slower reflexes. So some short-term effects of alcohol would be slower reflexes, especially while she's still intoxicated. She might not be able to comprehend everything that you are saying, which could equal the combativeness, just because she's not too sure what's going on. She's not too sure why. She's just confused, and so being in an environment where she's not comfortable, she may act out. Another one is mood swings and sleepiness. Now, the patient may be a bit tired, but in this case, it doesn't seem like it, as if it hasn't hit her just yet of how much alcohol she has taken in. And also clouded thinking, vomiting, and diarrhea are also short-term effects that could affect this patient at some point. So a nurse or some type of medical provider needs to be aware to look out for these things and maybe not leave the patient alone, especially if she is as intoxicated as she is and she's already fallen over. We want to ensure the patient's safety, making sure the patient doesn't fall. Now moving on to the long-term side effects, increased risk of diabetes because of the alcohol intake, increased tolerance. So as she drinks more and her body becomes comfortable drinking that much and processing that much, and when I say comfortable, I don't mean that it's healthy for the patient, but that the body gets used to processing and her intake being that much of the alcohol. Liver damage is definitely something that we're going to be looking out for, just because your liver does break down the enzymes that are in alcohol, and not the enzymes, the substance. Your liver enzymes break down that substance, and so therefore by overworking your liver, you're causing damage, and that liver is not supposed to be breaking down such high volumes of alcohol, especially in this case. We're going to be wanting to look out for stomach ulcers because of the throwing up and vomiting. You're causing that contraction to happen, and it could be involuntary, which could eventually cause some stomach ulcers. We also want to look out for high blood pressure because of the alcohol intake as well. And in severe cases, we want to look out for brain damage, because if that patient does happen to code and does happen to lose consciousness for an extended period of time, and especially with that shallow breathing, enough oxygen is not getting to the body, getting to the brain. So then we're at risk for brain damage. Another question, moving on, is why are the patient's hands shaking and what caused her confusion and combativeness? I have done some research, and delirium tremens is what it's called, which includes seizures, body tremors, rapid heart rate, confusion, anxiety, and these all do require medical attention. And this is induced by alcohol. Can be induced by alcohol. So this could be a major reason to why she is having the hand shaking, or maybe not being able to sit still, or just hyperactive, and combativeness and confusion because of the clouded thinking and clouded judgment. She's not too sure about the situation and what's going on. What assessments are needed? I'd say a full blood panel screening. We would want to, of course, run all of her levels, make sure they're normal. If they're abnormal, of course, adjust them to the best that we can. Especially check those liver enzymes. We want to make sure that they're not too high, because if they are too high, which in her case they probably will show too high because of the amount of alcohol intake she has had. We of course want to monitor vitals, be looking out for that high blood pressure, treat it when possible, and we want to do a psych evaluation. The reason we want to do a psych evaluation is because we want to be aware of why is she having these things happen to her. Moving on quickly, because I'm running out of time. The research question. It's asking about mental health. And the Affordable Care Act ensures and protects patients in having care for mental health disorders. So that means going to therapy can be covered by your insurance. Now, there might be a certain number that your insurance covers of how many, sessions you can have. So it's some cases you can have 9, some cases you can have 8, some cases you can have 5, and some cases you can have 15. This depends on your insurance, depends on how much they're willing to cover, but insurance does definitely cover it. What could make it better? I think that mental health disorders are especially happening right now, becoming more prevalent in people. Because of the pandemic, a lot of people have been cooped up in their houses, don't have great coping mechanisms, or never have had to be stuck in these situations where they do have to cope with having some type of mental disorder. When I say mental disorder, I mean absolutely anything. Negative thoughts about hurting yourself, hurting others. This includes bipolar disorder, any disorder that you can think of. Anxiety disorder, depression. Depression's prevalent right now, again, because everybody's cooped up in their house, not doing their normal activities. But some treatments that we would want to do is, of course, going to therapy, maybe getting on some type of medications if that is comfortable for the patient. Of course, we want to do what is best for the patient. If the patient doesn't think that medication will help, maybe go aim towards those therapies first and see if that will help prior to doing medication. Other than that, I have completed my assignment. I am going to send in my reference page and tag the link to this video in it. Thank you, and I hope you enjoyed the video.